Hey, Dave O'Sullivan here, and in this video I want to show you how to help your patients achieve their absolute dream outcome. Now, a lot of therapists that I work with initially, they come in and they complain about patients dropping off after 3 or 4 sessions or really feeling salesy to get patients back again. And I tell each therapist the same thing. The problem here, okay, is not what you're experiencing right now. That is the symptoms. And that is a symptom of not doing a thorough and a structured initial assessment. Because what needs to happen in the initial assessment is we need to set expectations with the patient. So we need to rule out red flags. We need a very good injury history in chronological order for the patient. And then we need to map out the full plan for the patient of where they need to get back to and want to get back to. Okay? Because what that does in the first session is it sets patient expectations that we're going to design a plan all the way through to the dream outcome. Very often what a lot of therapists do is they make it all about the pain experience. Okay, now if we look at the graded exposure program, the pain experience is probably going to decrease around C or D here. Okay, but the dream outcome it's usually ERF. So again, in professional sport, somebody tears their hamstring, for example, they could be pain free after 14 days. Doesn't mean that I can let them go back fully training. Okay, so even a grade 2, it might take another 2-3 weeks to gradually expose the patient onto the field, do all the running drills, tick all those boxes and get back into training. So we can't change the goalpost, because what a lot of therapists do is they just plan to maybe C, and then when the patient gets to C, we're trying to change the goalposts again, because everything up to now has been all about the pain, and now that the pain is decreasing, now we're trying to change the goalpost again. So what we need to do in the initial assessment is we need to set the goalposts, set expectations. If we do that well, it's going to take a lot of the lack of confidence, the feeling salesy, the not knowing where to go next. All of those things will be eliminated once you get some structure into your system. And it all starts with having structure in the subjective assessment, which builds into the objective assessment. But this is really the foundation in the subjective assessment, so we can get really clear on where we need to go with our objective. What's the gap from where the patient is to where they're getting to? That's going to dictate our hands-on treatment, and that's going to dictate the entry level of the graded exposure that we're going to go with rehab exercises. So you could see how the whole thing fits together, and encompassing all that is we've set patient expectations so that they know there's a plan to get the dream outcome. We're setting that in the first session, and we're giving them a realistic chance to know how long it's going to take. Now, if you want more help with this and putting together a structured step-by-step system to treat any patient who comes through your door, just pop a yes please in the comments below, and I'll send you all the information about how the Go-To Physio mentorship can help you be that go-to physio who has the confidence to treat any patient who comes through the door and build that go-to clinic based on a great word-of-mouth reputation. So if you want more information, pop a yes please in the comments below, or feel free to send me a private message. I'll send you all the details.